Hello, everybody. This is Dr. Kamel again, and this is a new series under the name of Pathophysiology of Important Diseases. So, in each video, we will be talking briefly about some diseases and the common presentation of these diseases. We will not go into too much explanation. If you would like to go to any of these diseases for more explanation, you can Google them or you can search online for more information. But this is just a brief summary of what you can look for or the common signs and symptoms disorder of these diseases. So let's start. This is Lesch-Nyhan syndrome. What is Lesch-Nyhan syndrome? It is HGBRT deficiency and reduction in purine salvage. We have something called purine salvage pathway, which increase de novo purine synthesis and will be increasing uric acid. So uric acid will be increased in Lesch-Nyhan syndrome. Okay, Lynch syndrome. Okay, which is MMRG mutation, mainly MLH1 and MSH2, failure of mismatch repair. S shape lead to microsatellite instability, which will increase the risk of cancer. CRC cancer, I think it is colon cancer, but I like to check because not every abbreviation I am an expert in. So, what is the meaning of CRC? CRC is CRC. It is a colorectal cancer. Colorectal cancer. This one is colorectal cancer. Okay. So this, mutation will increase the risk by 80%. Beta thalassemia, one of the hematologic disease, is a mutation at a spliced site or promoter sequence on chromosome number 11 with reduction or absent beta globin synthesis. So we will have beta thalassemia. Osteogenesis imperfecta is one of the, skeletal disorder. Mutation of COLA1A2 genes lead to type 1 collagen defect, inability to form triple helix. Okay, and this is osteogenesis imperfecta. Ehlers-Danlos syndrome is a genetic disease, is a faulty collagen synthesis, lead to hyperextensibility of skin, hyper, so it is a problem with collagen, synthesis, easy bruising, also hypermobile joint, hyperextensible skin, easy bruising. Lead to defective ATP7A protein, impaired copper absorption and transport, reduced lysyl oxidase activity, and decreased collagen cross-linking. Marfan syndrome, FBN1 mutation on chromosome number 15, defective fibrillin 1, increased risk of aortic root dilation, aneurysm, and aortic dissection. Okay. Prader-Willi syndrome, imprinting or maternal uniparental disomy to 25%, deletion or mutated expression of paternal allele. So brother paternal on chromosome number 15. Angelman syndrome, again, it is imprinting, but this time is paternal. not maternal. Disomy, 5%. Deletion or mutated expression of UBE3A on maternal chromosome number 15. Cystic fibrosis is a delta F508, a cystic fibrosis transmembrane regulator deletion on chromosome number 7, impaired ATP gated chloride channel. It is one of the mainly affecting respiratory system. Reduced chloride secretion in lungs and GI tract. Reduced chloride reabsorption in sweat gland. So it will be thick secretions and other complications. Duchenne muscular dystrophy, dystrophin gene frame shift or nonsense mutation. Okay, so frame shift or nonsense lead to loss of anchoring protein on extracellular matrix, mainly dystrophin, lead to myonecrosis. It's a fatal disease, Baker muscular is non-frame shift deletion. So Duchenne is frame shift deletion. This is non-frame shift deletion of dystrophin gene, partially functioning protein. That's why they live longer and they have less complications than in Duchenne, less severe than Duchenne. Myotonic dystrophy is CTG. This is a sequence of, the basis, trinucleotide repeat expansion in DMPK gene, lead to abnormal expression of myotonin protein kinase, lead to myotonia. Fragile X syndrome, this type is CGG, trinucleotide repeat. So myotonic dystrophy is CTG, fragile is CGG, nucleotide repeat in FMR1 gene, lead to hypermethylation of cytosine residues, decrease expression. Bitot spots in vitamin A deficiency, decrease differentiation of epithelial cells into specialized tissue, lead to conjunctival squamous metaplasia, conjunctiva of the eye, keratin buildup. Okay. Wernicke encephalopathy in patient with alcohol use disorder, given glucose, thiamine deficiency, okay, impaired glucose breakdown, ATP deletion worsened by glucose infusion. In order to correct the situation, so glucose infusion will make it worse. Pellagra in malignant carcinoid syndrome is a tryptophan is driven toward serotonin synthesis by tumor. Okay, so there will be B3 deficiency, and B3 deficiency is associated with pellagra. So B3 is derived from tryptophan, and tryptophan is diverted toward serotonin synthesis in malignant carcinoid syndrome. Core is a protein malnutrition, decrease plasma oncotic pressure, which will lead to edema, especially peripheral edema, decrease apolipoprotein synthesis, fatty changes in the liver. Okay. Aspirin-induced hyperthermia, increased permeability of inner mitochondrial membrane, reduce proton gradient and increase O2 oxygen consumption, uncoupling, lead to heat production. Hereditary fructose intolerance is aldolase B deficiency, lead to fructose 1 phosphate accumulation, decrease or reduce available phosphate, inhibition of glycogenolysis, and gluconeogenesis. Okay, thank you. This is number 1.